Kazampo, welcome to Bhutan This Week. I'm Kazawangmo. Our top stories this week. His Majesty is on a royal tour of areas under lockdown. The Prime Minister said there will be no lockdowns even if there are community cases from next month. And Bhutan joins 140 other nations in the UN General Assembly asking Russia to withdraw troops from Ukraine. His Majesty the King visited Gomtu and Samti last week from Funsling while on a tour of areas under lockdown due to the detection of community cases of COVID-19. While in Funsling, His Majesty visited the Amuchu temporary shelter, which is one of the centers of community outbreak. Those with comorbidities and the most vulnerable were moved to other places to protect them. His Majesty travelled to Gomtu and Samti and granted audiences to the task force teams and frontline workers. A consignment of 270,000 doses of Pfizer vaccine arrived in the country on Wednesday. It will be used to vaccinate 5 to 11-year-olds with both doses and as boosters for people aged 12 to 17.
The vaccine flew in at the Paro airport this morning. The distribution to various districts started immediately. The Prime Minister said the children will be vaccinated within 10 days.
Longali chuchi be mediswe the kap di chaptu be sitin ya kap rirenging nala paludi deru a chap chisubera chap sai la ya kap chingi china pa chap sai lalu china la palu da besumi kiko yumi pham disugi atire chap di to zamling nara chap chobigi nawa hinsang sabe yumi di Pfizer di ime alugidila ani ngachigi ya kap na chap ni gi thandi zo.
There are more than 83,000 5 to 11-year-olds and more than 80,000 people aged 12 to 17. But the Health Minister said only about 50% of the 5 to 11-year-olds has registered so far. The ministry is urging people to register their children.
Mapani registration a couple of options. You can either put your CID. If you don't have, you can put your MCH card number. If not, then you can put your phone number. If not, no CID option
Though the fourth dose is not yet recommended, Bhutan remains ready in case the global trend changes.
Kapti ngachara ata zumbera niji jeme zumbe lotarlura goni zumbe du sevgi kae pepchi tani beni digita do dugi jable goga do jutam chuchigi jable goga shunimi to re ngachigi booster lentengi bomdila ani kap lente jibamde ngachigi thandi chabbe misulu phunigi chaji se shunibila.
The government has also ordered vaccines for 2 to 4-year-olds, although approval has not been granted for this age group. Bhutan is also getting enough vaccines for adults. Foreign Minister said Switzerland has agreed to give vaccines whenever the need arises. He said Bhutan is signing a trilateral agreement with Switzerland and Pfizer. For Sonam Tenzin, Game for PBS News.
Announcing the government's plans and way forward to manage the COVID-19 situation, the Prime Minister said there will be no lockdowns even if there are community cases. This new strategy will be implemented from next month. The announcement comes amid news of some of the developed countries easing COVID restrictions and choosing to live with the virus despite record infections. The Prime Minister said they have been planning this for more than a month now on His Majesty's command.
The Prime Minister said the new strategy will be implemented after all children aged between 5 and 11 are vaccinated. According to the Prime Minister's office, the National Task Force met after the Prime Minister's address to revisit all the existing SOPs to align with the new strategy.
Dodilkadam bemagobachin de shipje chabdagi chapthange sojongla. Primary context dewa yumigi mingomjisugi iwa chathange sojongla. Belen ngachara sago ngenka yubda mip se nyema bewachin de nasan samgi sago nala phalu ngenka yu karagi shibet kachibena de nana ludi ngenka mibbe sago ngenka yuminale mimina jodalwe dunta chigi sursha debe jogola gyakap nangkyugi dodul nalo dunta chigi sursha begomide de jura jong se shunibena.
Today, it is mandatory for anyone traveling into the country from abroad to undergo 2-week-long quarantine if they are vaccinated, and the unvaccinated travelers are required to stay in quarantine for 3 weeks. Domestic travelers from high-risk to low-risk areas are required to stay in quarantine for a week.
갑디첩 니지디 미비 딱선이 여바친 소셔나 듀모고비기 디지사베 게합레 셔기 조데라 나체 티수 다 마시베 멘 베마츠베 멘 시슈니비 베츠 디보다 년카 티체세 로또 춘추 마치기 디지디 미데나루 니지 마팔레 메바 드니기 고컵 네카 베니디기 딩아치기 양차 타마술라 다 닐레 파타 조잉알레 미데나 니지 유메 리링잉이로 오미갈레 마치기 디지티에 남스미 사타코타베자디 마치루 펜 메토 세슈니베일라
The way the COVID patients are managed will also change.
도토베와친 니지 유미치 두세오친 디이룸메루 데 투디기베 니지 유미기 소샤테와나투 디다치가 데와 타미기 미디수 가라 디다 니지레 미텐가마 세기 야 독바 유미기 소샤테와 소소나투 자셀라루치 캅체 라루치 이칼라팔루 데다 따노 심제타니기 고카베 지마숲라라루 사고나도 같이 다마 튀미캅루 유입질레다르디 디수가라 아츠레 주치베이 세슈니비 도토 춘수기 디지 아니베 다 람루 사브데 오만가레 아니소에 dumtare 땡아치기 디 소디 땅고 세슈니비
But the Prime Minister said lockdowns will happen if hospitalization increases or about 70 to 80% of beds in isolation wards are occupied. Lockdowns will also happen if there is a new lethal variant. It will be a complete lockdown for at least 2 weeks. The Prime Minister said people should shoulder the responsibility of protecting themselves and communities at large from infection. Pukkem for BBC News.
Due to the continued increase in COVID-19 cases in some parts of the country, the Education Ministry has postponed the reporting dates for students to schools. This is also due to the government's decision to conduct mass vaccination for all students from the first week of next month.
There are some changes to the dates for schools to reopen this academic year. All border students will report to schools on 17th April and day scholars on 18th April. This includes all students from classes PP to 12. Early childhood care and development and non-formal education centers will also reopen from 18th April. Primary and lower secondary school teachers have already reported to schools. They will undergo professional development programs and other activities. Teachers of higher secondary schools will return to their schools on 14th March after the class 10 and 12 exams end. Teachers who will be engaged in evaluating papers will have to report on 11th April after making ends on 8th April. Sringdandu for BBS News.
According to the Royal Civil Service Commission, 187 civil servants have been redeployed in various agencies as they were identified as excess staff. Most of them are from the Agriculture Ministry and the Ministry of Works and Human Settlement. They were foresters, extension supervisors, engineers, junior engineers and technicians. A press release from the Commission said the 12th five-year plan staffing found these positions were no longer required or could be multitasked. All civil servants at the P2 level or deputy chief level must undergo an integrity test for promotion from July this year. According to the Royal Civil Service Commission, the officials should submit Ethics and Integrity Course Completion Certificate. The certificate is valid for 5 years. They will have to take an e-learning course to create awareness on civil service value and conduct and anti-corruption concepts. The officials have to complete all activities and pass assessments. The course was developed by the Anti-Corruption Commission in collaboration with the RCSC. Bhutan voted for the United Nations General Assembly resolution calling on Russia to end its hostilities in Ukraine and withdraw its troops. The resolution, supported by 141 of the Assembly's 193 members, passed in a rare emergency session called by the UN Security Council.
Bhutan has closely observed with deep concern the rapidly escalating conflict on the ground. We join others in calling for the respect of Ukraine's sovereignty, independence, and territorial integrity within its internationally recognized borders. Perched atop the Himalayas, even the folds of our mighty mountains cannot shield us from the reverberations of events thousands of miles away. Today, core principles of the UN Charter and a rules-based international order are at stake, endangering international peace and security, far beyond the borders of Ukraine and Europe. Mr. President, each and every one of us, big and small, rich and poor alike, have, on admission to the United Nations, ascribed to the purposes and principles enshrined in the Charter. Bhutan made that solemn pledge over 50 years ago. These are principles all member states are beholden to, but for small states, they serve as the guarantor of our existence.
The Bhutan Agriculture and Food Regulatory Authority, or BAFRA, rejected 12 tons, or about a truckload of imported green chilies in Samdup Jongkhar on Tuesday. The chilies tested positive for the presence of pesticides. The government started importing green chilies in January for 3 months to ensure availability and curb illegal imports.
This consignment of green chilies reached Samdup Jongkhar on Monday, but it was found unfit for consumption due to its high pesticide content. It was imported from Falakata in West Bengal. The Food Corporation of Bhutan, or FCB, spent more than 1 million ngutam. BAFRA has asked FCB to send back the consignment immediately. Imported green chilies are tested as per the standard operating procedure so that it is safe to consume. Since the local winter chili production meets only about 20% of the demand, shops in Samdup Jongkhar Tromde are without green chilies.
It has been more than 2 weeks without chili. We are told that it will be brought yesterday, but I think due to the chemical content, it was sent back.
It has been 3 weeks without chilies. People come here looking for chilies.
Farmers of Pemathang Chiok in Pemathang Giok tried to grow winter chilies, but pest infestation affected the cultivation. The Agriculture Ministry banned the import of green chilies in 2016 due to high pesticide content. For Kilawachu in Samdup Jongkhar, Sringdandup, BBS News.
Funsling gets an additional hospital. Upon the command of His Majesty the King, the Royal Institute for Governance and Strategic Studies in Funsling becomes a mother and child healthcare hospital from 1st March. Nearly 100 women and children came for various services. It is a temporary measure amid the increasing COVID cases there.
Usually, only officials are seen in this building as the institute housed the Southern COVID-19 Task Force. But as the mother and child healthcare services are being provided from here, women and children are seen comfortably seated here. As Funsling records more COVID-19 infections, the hospital came in as a huge relief to the residents as well as the health professionals.
Ja, men kan ha joined the risk to bada as you are the disability. Nije this pa no sen penny gini ha yebe. Kana po be the top to do timase na lo ani midiso ni risk peso this. Legend bada as you social distance this shots away session and top to do.
Ya di mapa gena be good gola na di good mo be. Saka desan nam sam ka to bedu. Saka denisa gudu mapa ngachi longin du kitab laro ani sembi kitab la kuno wachindi kitab do meto disudo delia chika lefa be nam samaja shi deshum do mala
neong thing david disulu de ngachi myong adar musigi desum kiduna riksna na di na amsame karinchi tambora te nana jo tawda te nana gi ani netang desu beru de ani sago beru namsame hinsasa te tab de to do sejini pila.
Funsling Hospital also plans to start dental and eye care services from here. This is the third area after the parking lot where medical services are being provided from. It is going to make the lives of about 20,000 people living in Funsling much easier to get healthcare services. For Sonam Penjor in Chuka, this is Tanden Funso for BBS News.
The pressure on the isolation and de-isolation facilities in Funsling has reduced. More than half of the COVID patients chose to isolate themselves in their homes. The task force allowed nearly 500 people and their primary contacts to stay under home isolation since last week.
Red stickers like this can be seen in nearly 500 households. It means there are COVID patients inside. Outsiders are not allowed to come here. Those who wish to stay isolated in their homes are allowed to do so. Separate medical teams are also there to provide services in these red buildings.
rangi chimnara te tu shunil te pha isolation pha pawajin titab madhyo ilojule.
It is comfortable to stay in home isolation. Through social media platforms, we heard a woman crying and sharing her experience from an isolation facility. Moreover, when people are detected with the virus, they have to stay away from their families and it is difficult. Staying in an isolation facility is a burden to the government as well.
It is better at home. We can serve ourselves hot meals. We can eat anything we want, which may not be possible in isolation facilities.
Despite detecting positive cases from the community daily, the isolation facilities in the town are being managed comfortably. Unlike in the past, every COVID patient is not taken to isolation facilities. There are 9 isolation and de-isolation facilities in Funsling. It can accommodate more than 1,000 people. And today, almost half of the facilities are empty. For Sonam Penjor in Funsling, this is Tanden Funso for BBS News.
Tashigang is a green zone without a single positive case of COVID-19 as of today. But this has not kept the district's residents from fear of COVID infection. With an increasing number of people from various parts of the country traveling into the district every day, the residents worry about reporting COVID cases from the community.
Around 100 people enter Tashigang every day by flight, public transport and private vehicles. Travelers are allowed to enter the district only upon testing negative for COVID-19. But the district's residents said this does not guarantee that the travelers are COVID-19 negative.
We worry that there might be an outbreak as vehicles keep coming here from the high-risk areas. In case we have a positive case, we will be in trouble as we don't have a big hospital.
We cannot trust the COVID test results. Some test positive later on. Here at Rangjung, we have 2 buses stopping by. The travelers do not go home straight. They stop by to do shopping. We fear that we might get infected.
Travelers are advised to stay in home quarantine for a week. And according to the Tashigang Zongda, local leaders have been sensitized to monitor.
We have informed the Geog's local leaders and even our health staff to make phone calls to those in home quarantine within 2 to 3 days to monitor them. That being said, we cannot say that we can monitor everyone without fail. We have more than 100 people coming into the district every day. However, we have asked the Tsokpas to inform us and the police if they breach the protocols.
Although Tashigang District Administration has not received any written complaints regarding breach of home quarantine protocol so far, some do not comply, according to the Tsokpas.
As per the directives, we try our best and ask people to stay in home quarantine, but some do not follow, and we can't monitor them every time. It will be effective only if these soups guard the households.
The people who come from outside are following orders and staying in home quarantine, but their family members keep going out. So, the home quarantine does not serve the purpose.
The Zonda said that individuals should take responsibility to follow protocols and prevent the virus spread in the community. For Sonam Darje in Tashigang, this is Tanden Funso for BBS News.
And this is all we have for you this week. Thank you for joining us. Stay home, stay safe. Goodbye.